here in probably just a few minutes as soon as Chad is ready, and we have everyone entered into the room. Chad, I feel like we need to have some music or something in the background.
Yeah.
I mean, I feel like that's
Yeah, that would be nice.
kind of your forte too.
not singing, but the technology music, techno music. Wait, are we recording?
We are.
Okay.
Please no.
Professional hat on. Music would be great. Thank you for that recommendation, Heather. I'll add that to my notes.
Well, I think everyone's getting close to being here, and in respect of everyone's time, and we only have an hour together today, I think if it's okay, I'd really like to get started. Well, welcome everyone. My name is Heather Winklepleck. I'm with the Prevention Initiative at Wichita State University Community Engagement Institute. We're happy to have you here, and we know the right people have gathered here today to make the most difference in our families and families of those we serve. This series is being brought to you at no cost for the purpose of engaging others and continuing the work of promoting behavioral health and prevention support in our families and communities. Prevention Initiatives is dedicated to supporting partners in using evidence-based and best practice prevention and promoting strategies working together to build healthy communities. Through partnerships, connections, and guidance, we specialize in behavioral health promotion and awareness campaign development, prevention strategy, project management, social marketing for the behavioral health change, and youth-led behavioral health group development. We've been partners with the Sedgwick County Sheriff's Office recently in efforts of community building and violence prevention. Hope Starts Now, Kansas, for response to parents who are pregnant and concerned about opiate use. Additional opiate misuse prevention strategies like Learn, Lock, Lead, and Operation Prevention, and the Kansas Prevention Collaborative. We've become aware of the significant challenges facing youth, young people, older adults, and families by blood and by choice in today's culture. This is our first service prioritizing families and promoting prevention strategies to help families seek help and experience belonging as they are doing the best they can in their situations. We are a close-knit team of behavioral health professionals and people who value the healing and power of relationships. For more information about our team and our work, we will share the website in the chat at communityengagementinstitute.org, and I will share that in the chat here in just a second. And Chad, if you wouldn't mind sending me to my next slide. We will be supporting families through prevention in this 4-week series. We had our first session last week, and it was wonderful. These 1-hour sessions, if you haven't already, would you please introduce yourself in the chat with your name, your pronouns, your organization, and 1 or 2 words about yourself. And when you hear family. These days are tough. We're pulled in all different directions and may even find ourselves tempted to multitask during these hours together. We understand and only ask that you be present and engaged as you're able during this time today. We assume most of you are familiar with Zoom meetings at this point and ask that you mute your microphone unless you're intending to be heard by everyone here. We also encourage you to turn your web cameras on if you're able and willing, as it helps with engagement, support, and being fully present when it's as close to being in the same room as possible. This is your choice though, and we respect whatever you decide. Please use the raise hand and other reaction features as you like. And if you have questions about how to set up your view of the screen or any of the Zoom features, send a chat message to everyone or to Chad Childs or myself, Heather Winklepleck. Growing, nurturing, building, supporting, cultivating, and bolstering families with resources, tools to help face today's challenging times. And we really appreciate you joining us to promote family attachment and build our community resilience to our kids in 2022. This 4-week series of 1-hour sessions on every Wednesday in September is especially for families and children, service providers, faith-based communities, schools, staff, civic and community organization, volunteers, parents, parent group members, and anyone who offers support to their families or those of others. These sessions are connected to each other and will cross-reference those connecting points as we go through this series. The main topic of the remaining sessions are prevention tools for families, which is today, which Chad will be sharing with us, healthy boundaries next Wednesday, and then preventing family violence on September the 28th. The sessions are being recorded and will be sent out to your email address later for future viewings, review, and sharing with others. The recordings will focus on the primary screens being shared, and your image and name may show on the recordings only when you are speaking. We love and value our families and the impact they have on us and can have on the future. We care about families too and want the best present and future for them. We consider it a privilege to work together and with you and using prevention tools and strategies to equip them and us to increase chances for strength and resilience. At this time, I would like to introduce Chad, who will be facilitating today's special section. Chad, if you would like to begin, thank you.
All right. Thanks, Heather. It's good to be here with you all. Excited about seeing you all again, familiar faces and some new faces, new names. Hopefully we'll learn something from each other today, and I think that we will. Our couple of our primary purposes are here on the screen now. Is that advancing okay for you all? Are you seeing the primary purposes slide? Okay. So one of the purposes is we're hoping to have an enduring understanding that we build today, that participants will explore which suggested tools for prevention will be most effective or useful, or effective for their families. They could be with your own family or the families that you work with. And then a transfer goal that we have is that participants will be able to practice using a tool that they've selected and evaluate the helpfulness of it for their lives. So we're actually going to talk about a few specific programs, strategies that you may have interest in practicing during a breakout time that we'll have during this session. Let's see here. Okay, this is our agenda for today. I'll go through I'll highlight a few tools. These tools are not anything that comes from a recommended set of go to implement these strategies and you'll receive $1 million. It's nothing like that. There's no incentive other than that they've been determined to be evidence-based and effective with families in some of the areas that we've identified to focus on today. We'll move into some practice opportunities for you in breakout rooms, small groups, and challenge by choice. You don't have to practice if you don't want to with others. And then we'll do some comparison of how did that go? Did you like the thing that you just practiced, or do you like the thing that the other person in your group practiced more? And then we'll evaluate. So make decisions about, I think this could be effective, or I think this one would have some challenges, and let's talk about it. Let's identify those barriers or those challenges and think about some other tools that you might use. With all of the tools that I'll be presenting today, I want to remind us of some information, and some of you may be more familiar with the research that's been done by the Department of Health and Human Services, the Office of Inspector General. They issued a report in this year, 2022, that really focused on the fact that more than 7% of foster children in Kansas went missing during a 30-month period, placing it as one of the highest such rates in the nation. I think top 10 for sure, maybe number 7. TFI Family Services Incorporated was one of the state's contracted case management service providers for youth in foster care, and they partnered with the School of Social Welfare researchers at KU to look at a study to further dig into this and try to identify why there may be so many missing children in foster care in Kansas. And so they did a study that it was a mixed method study, included interviews with 20 youth ages 12 through 17 in Kansas foster care, who had and who had not fled from their foster placements. And so the research team identified 5 key findings, and those are on the screen here. And so there are things that, with all of the tools that I'll be talking about today, I encourage us all to really be looking for how might we build the protective factors of family bonds and attachments, feelings of safety and control, promoting belonging, and offering a sense of normalcy, as well as meeting needs. And that's something that I think we heard a little bit about last week from Georgina LaFoe. Georgina did a great job presenting the series session last week, and really focused on all of these areas actually. So it's something that we hope to build through all the tools that we implement. And we'll move on to a section to talk about some tools. If you don't mind, use a Zoom reaction or type something in the chat, or just let us know if you've heard of the family checkup. I'm not going to ask you to report out on it, but we'll talk a little bit about it here. So the family checkup is it's a brief strengths focused intervention, focusing on kids ages 2 through 17. It promotes positive child outcomes by improving parenting and family management practices. The family checkup has more than 30 years of evidence demonstrating strong intervention effects. The impact on childhood includes less behavioral and emotional problems, less conflictual relationships, increased emotion regulation, school readiness, and accepting relations with peers. It also has an impact on adolescence, including less drug use, less antisocial behavior, less bullying in school, and less depressive symptoms. And it benefits adolescents in terms of school attendance and grades. Has been found to have impacts lasting into early adulthood with decreased marijuana use, tobacco use, and alcohol use. And it also has impact for parents, with parents it's been demonstrated to have, excuse me, less parental neglect of children, less depressive symptoms of the parents, and less levels of conflict. It also improves well-being, social support, parenting, relationship with children, and co-parenting relationships. It also helps with using community resources. So the family checkup is an evidence-based strategy that comes out of the University of Oregon to provide training, consulting, and some software services in support of evidence-based programs like the family checkup. So it's something that was included in our resource list here at our last slide for this session today. And so you'll see that. You also see the web link that is there on the slide. I'm sorry you're not able to quickly click that, but you can Google. Oh, Patricia Houston, thank you so much for putting that in the chat. It just made my morning. Okay, so we'll move on then to talk about another one. And one of the things that you might see as we go through these tools and resources to consider for implementing to support families is that they may have some benefit in the child-parent relationship. That's a common thread throughout them. But they also, some of them have some positive kind of side effects or positive additional consequences in the way that some of them are actually evidence-based prevention strategies for substance abuse. Strengthening Families Program 10 to 14 is one of those programs. It is a program that's been created to increase protective factors and reduce risk factors, teaches skills involved in bonding, setting boundaries, monitoring emotional well-being, and really works also at skills practice. So you have a session with the youth, a session with the adults happening at the same time, and then you bring them all together and they are able to practice some things that they learn. Thank you for the link there too, Patricia. And Heather, would you mind putting the handout for lesson 1 and then also lesson 3 in the chat? We'll talk about these a little bit later, but these are some handouts from the actual course material that you'll have an opportunity to pick and decide if you want to practice one of those and adapt it in a way that you're comfortable in our breakout session practice time later on this morning. So I'm going to move to nurturing parenting. If you're able and willing, let us know in the chat if you've heard of nurturing parenting. It's one was newer to me. Or use a Zoom reaction. So The Nurturing Family Program is one that has been determined evidence-based. It's family-oriented and trauma-informed initiative. It was designed to build nurturing parenting skills as an alternative to abusive and neglecting parenting and child rearing practices. The long-term goals are to prevent recidivism in families receiving social services, to lower the rate of multi-parent teenage pregnancies, to reduce the rate of juvenile delinquency and alcohol abuse, and to stop the intergenerational cycle of child abuse by teaching positive parenting behavior. So that's something that there's a link. Allie, you use it. Allie, would you mind coming off mute? And you don't have to, so you can say no, but are you able and willing to come off mute or to enter into the chat something about how you use it and how it's going?
Sure. Hi, sorry I'm off camera today.
No,
But yes, there's 3 of us from Foster Adopt Connect here. I'm in Kansas and Missouri, but we also are in Missouri. We're a Families First Prevention Services Act program in Kansas. And we are an in-home program to prevent kids from coming into foster care. So that's how we use it. We have expanded to some support groups as well. But we do like the flexibility of the program and the ability to supplement and to use it how it best works with the families that we serve.
Okay, great. Thank you so much. Thanks for sharing that. Let's see. Familias Unidas is a multi-level family-based influenced by culturally specific models developed by Hispanic populations in the United States. Is anyone, well, I'm going to invite you all to use your Zoom reactions here or say something in the chat. Do any of you currently use or have you previously used Familias Unidas? Unidas, sorry. Okay, it was developed through multi-parent groups. Excuse me, it was delivered through multi-parent groups with school personnel, including the school counselor and teachers. And thank you, Patricia, for putting the link to the blueprints description of the program in the chat. I appreciate that. It involves family meetings of parents with school personnel, including the school counselor and teachers. So it's a nice connection for the youth and their parents and school staff. The family activities involving the parents, the adolescent, and their peers are used to connect the adolescent with their peer network better and to practice monitoring skills, checking in to make sure everything's going okay and people are staying out of trouble and not doing anything too dangerous. The facilitators must be Spanish speaking and bicultural. They must have a minimum of a bachelor's degree in psychology and 3 years of clinical experience, or a master's degree and 1 year of clinical experience. So there is a little bit of a raised standard for the fidelity in terms of training that providers of this program are expected to be prepared to offer a little bit more expertise through formal education anyway. Family activities really do reduce risk for behavior problems like illicit drug use, alcohol use, cigarette use, and unsafe sexual behavior in Hispanic youth and adolescents. It's designed to prevent substance use and sexual behavior. And the multi-parent groups are led by facilitator that meet in 8 to 9 weekly 2-hour sessions for the duration of the intervention. Each group has about 12 to 15 parents with at least one parent from each family participating. So the sessions include problem posing and participatory exercises where you actually get to work together to try to solve some problems that have been identified. I'm going to move now to Operation Prevention. So this is a class that we promote at CEI Prevention Initiatives through our role with the Kansas Prevention Collaborative. It's something that our partners at DECA have promoted as well quite a bit. And so Operation Prevention is you can find this course that's intended to be one of the most tested and most evidence-based early intervention strategies for opioid misuse. And Operation Prevention is found there at their website that's supported by the DEA and Discovery Education. Heather, if you wouldn't mind, would you be able to add the parent toolkit handout to the chat? People can click on that and open and download. If you're not real familiar with opening attachments in Zoom, you might have to click it a couple of times, or sometimes there's a sequence of you click on it and it kind of identifies a way to save it, and then you click on it again, and then you have to save it to your computer somewhere or your network, and then you can open it. So it's, at least for me with my machine, it might be because it's an old timey Dell. I have a 3-step process, I think, but for those of you that are using Macs, it probably opens up just when you think about it. So Operation Prevention has this parent toolkit, which is a great resource. It includes some different things, and we're going to talk about section 3, which is parenting styles and skills. We're going to actually look at one encouragement practice to focus on how you can practice increasing words of affirmation and encouragement to children, those are things are important to building positive and healthy relationship, as many of you know, or all of you might know. You can provide your child with encouragement by reminding them of what their strengths are and things that they're good at, remind them of times that they've worked hard and been successful in the past, remind them of the things that they've said before so that you can show them that you're listening to what they say. Ask for their input when you're making family plans or activity plans for the day. Attend their extracurricular and school activities and events, display their work and accomplishments. My kids still love seeing their name on our refrigerator at home. And even if they made their certificate themselves, we have that framed in our house. My son did not really graduate from Harvard Medical School, but we have a certificate that proudly proclaims him as a graduate of Harvard Medical School, with misspellings included. But it's a thing of beauty. Make time for our kids each day and praise positive and desirable behaviors are some of the things that we'll talk about. But Operation Prevention is an online class that you can implement in a school, in a youth group setting. You can implement it in a family setting, but there are some different ways for parents to build upon the things that are being taught and learned in Operation Prevention as well. They also have a toolkit. Oops, I clicked too fast. They also have a toolkit, not just for parents, but they have one for educators and professionals as well. So that can be something that's really helpful supplemental information. We're going to talk just a little bit about partnerships to end addiction. And I'm going to ask Heather, would you mind putting in the power of attention? So power of attention is one that's not a part of partnership to end addiction, but I wanted to focus on it here because it's another way that I've learned to really build relationships with kids and build a safe and healthy environment in a preschool classroom. It comes from Dr. Becky Bailey's conscious discipline work, which falls in line with a lot of these 10 key protective parenting strategies that the Partnership to End Addiction has identified. So you see that the list on the screen here. The conscious discipline model and the power of attention really looks at what you focus on, you get more of. So if all you're seeing, all you're acknowledging to your child is all the things that they've done wrong, the spills that they've made, the people the times that they might have hit or bit somebody. If you're focusing only on those, that's the child's learned way to engage you in relationship. And so it's really important that we focus on the things that we want to see more so that our relationship can also be built and strengthened on the things that we want to see them doing more. So got a list of things here that the Partnership to End Addiction has highlighted. Also going to share a little bit more about the wealth of resources that they've provided on their website. I recommend that you go to spend some time at Partnership to End Addiction whenever you've got some free moments. There are too many things, too many resources and tools to get into during a 1 hour series and during our whole 4 week series. But I recommend that you go there and learn some things, and you'll probably find some resources that you can share with parents that you're working with. Okay, so now we're at a point where I'm going to ask you to practice a little bit, and I'm going to challenge you to be bold and try something that maybe you've just seen for the first time today. This was going to be pairs, but because some people are not able to join breakout rooms in time, or some people exit out of a session altogether and leave when it goes to breakout rooms. You don't need to do that. We're going to make the groups a little bit bigger than pairs, so that you can stay logged in and paying attention or not. But I invite you to stick around for this activity. It won't be very long. We're going to be in small groups. I'd like for you to spend a couple minutes total introducing yourselves to each other. Could just be names. Could be names in some kind of icebreaker, like your favorite winter garden crop. I don't know, but it could be any way that you want to introduce yourselves. Then we'll have about 3 minutes for you to read. They're in the company of others, but you don't have to read it aloud, but read through some of these things that we've shared in the handouts. And I'd like for you to pick one that you want to practice with your group. And so everybody's going to have an opportunity. We probably won't have time for everybody to actually practice it, but we'll be looking for volunteers to practice that activity. So if it's Becky Bailey's power of attention, you can go into that and you can just practice some of the things. What are some of the things you saw today that you really liked and that you want to see continue? What are some of the things that a child that you've been working with recently, or that your own child has done that you like? So it might be a good time to just brag about your kid with each other. But going to have you practice and then take turns doing that. So somebody will practice one of the things, one of the programs, one of the strategies, one of the tools, and then somebody else will as well. So we'll take turns. And then I'd like for you to end this time. We will probably, I think we're going to have 20 minutes in our breakout rooms altogether. So we'll go to our breakout rooms. That's a little bit of time. Read up and decide which one you want to practice with your group. If you're willing, you'll have about 10 minutes to practice. Then you'll have about 10 minutes to talk in your group about, ooh, I really like that one. I'm going to do that with my family tonight. Or I like the one that I just practiced and I've got good at it. And so I'm going to do it tonight with my family or with somebody that I'm working with. So what we'd like for you to do at the end of that time of commitment and practicing with the tool is state a goal that you'd like to be able to brag about tomorrow, brag about achieving tomorrow. So there's something that you want to take home to work on tonight. You're going to practice it, and what will happen? Maybe your kid will jump up in the morning and go brush their teeth unprompted and put on their deodorant and get dressed for school, and you won't have said anything, and it's just all based on the positive relationship that you built tonight. I don't know what the outcome is, but dream big. Janelle, are we about ready to go to breakout rooms?
Yes, I was just actually going to type in the chat before we go to breakout rooms, kind of what we're doing.
Yes,
so,
please. Thank you so much.
Yeah, so let me just do that real fast.
That'd be awesome.
And then this might be a good idea if you haven't clicked on those attachments that Heather has put in the chat, go ahead and do that before we go to breakout rooms as well.
Yeah.
All right, I typed it all in the chat, so everyone should be able to see that still once we go to breakout rooms.
Awesome. Thank you for doing that. I appreciate you thinking of that. All right, so we will bring everybody back from breakout rooms let's bring everybody back at 11:45. So it'll be a little bit shorter than what I said, but 11:45.
Okay, something should pop up to take you to a breakout room.
Do you want me to pause recording?
Yes, please. Let's go. All right, I think we're all back. So we will, I hope that you had some engaging conversation and have some plans for things to do tonight. I'm not going to ask you to report out, but if you identified something that worked well or did not work well, and you're comfortable sharing it in the chat, please do so. We're going to do a little bit more kind of intentional comparison with a couple of questions, and these will be asked in the chat. Janelle, would you mind asking the first poll, I guess, the first poll question for how effective do you think the strategy you practiced with zero preparation, how effective do you think that could be if you use that with a family, your family, or one that you work with? On a scale of 1 to 5, with 5 being most effective. Okay. Got about 30 seconds left. Okay. All right, let's go ahead and close that poll question, Janelle, and then share it with all of us to see the results.
Are you able to see them, Chad?
I am. Are other people?
Because the whole scan, but
Can others see the results?
the others see it.
Yep.
Yes.
Okay, great. So yeah, it looked like none of them were a waste of time. It looked like those that responded felt like it could be effective to practice with a family. So that's good to know. And a worthwhile experiment. The next question, and we'll ask this in a poll as well, is how effective do you think the strategy that your partner or somebody else in your group practiced could be with your family? So maybe it wasn't the one that you picked and practiced, but it was someone that another member of the group practiced. How effective would their idea, their chosen strategy for practice be with your family or a family that you work with? Melissa, thanks for sharing that in the chat. I think that's great. My kid called me, my kid texted me. I had good communication with my kids yesterday. That's something that I want to encourage. Okay, let's stop that poll, Janelle, and share it. Okay, so there, one of the respondents didn't like so much the idea suggested or tried by a team member, but looks like a good amount were still we have some confidence that those evidence-based effective strategies could be useful to try with our families or those we work with. So that's good news. Okay, so we will move on to some evaluation. And so in this part, whoops. Okay. No, that's right. No, that's not right. I'd like we will do a little bit of conversation here. So if you are willing and able to open your microphones or type in the chat, what was something that, if you know of a prevention tool or strategy, one that we talked about today, or one that you would like to share with others, that's a good activity that you recommend someone try with a family, with the family that they work with or their own, go ahead and type that strategy that you really like, or even just an activity, a skill, a strategy that you like and would encourage others to do it. Looks like there's a lot of good responses and support to power of attention. And power of attention can be really powerful. It's not something that I think there may be some concern about only being positive, and that not being a way to discipline, but I think that this doesn't mean only being positive and not acknowledging the things that need to stop or can't continue, but when we can outweigh those constructive criticisms and corrections with some positives, I think there's a great opportunity for bonding and attachment. Mary, thanks for that comment. That there really are, and something that I think people struggle with sometimes is that they feel like there's nothing that they can do that will help, and that I'd like to acknowledge that sometimes it feels like that, and that can be really real and feel pretty depressing. And you just haven't found the right one yet. There are a lot of different strategies and tools out there that we can look at and try to find the one that seems to fit our family, our parenting style best. Paula didn't know about any of these resources, so that's another thing that we need to focus on, I think, in prevention initiatives and others that are serving families, is that we do have an opportunity to let people know that there are a lot of different things that they can do or try. And then if you find something that you are interested in, then we can work together as communities and organizations to connect people with those different tools or those programs that are available. Okay. Thank you for all of that. Yeah, Janelle, good point. Yeah, definitely. So Patty, we will, I've got a goal to send the recording from last week out by this Friday. I'll try to send today's session out by this Friday. I'll send the PowerPoint, the slide deck, as well as the video recording. So if anybody wants to review that later, they can. Works cited. There were a lot of things that I at least touched on during today's session. So this was just an hour and we talked about a few things that were highlighted, but there are some additional links that I wanted you all to have and that we'll send in the slide deck this as well. And so there are a wealth of resources available for parenting and increasing bonding and attachment and trauma-informed strategies that can also prevent substance abuse and child abuse and neglect. And a lot of them have shared protective factors built in to try to help people have healthier and more supportive relationships. So this comes to nearly the end of our time together. I want to give you all 5 minutes, I think, to get where you need to go next for your next Zoom meeting, but we'll hang out here and stop the recording and see if you have any comments or questions or anything that you want to discuss aloud. But thank you all for your time, and I hope you have a great day and focus on the things that you want to see more of.